Hey guys, this is Chris Dewey with May River Medicare, and today we're going to talk about enrolling in Medicare. We're going to talk about folks that are new to Medicare, that are drawing Social Security benefits, that are going to enroll in Part A and Part B when they turn 65, or are getting their Part B effective date for the first time. We're going to talk about folks that are still working, that have group coverage, and we're going to discuss how Medicare coordinates with your group coverage and what you can do and when you should do it. All right, and the third group is folks that are turning 65 are enrolling in Part B for the first time that are not drawing Social Security benefits. They're not getting their check every month. They're going to have to do something totally different in that situation if you're not drawing Social Security. So, by the way, if you could, we are a Medicare advocacy that educates seniors the right way so that you can make decisions. We educate, we empower you so that you enroll with confidence is what we do. And I would love it if you could just look right below this video and hit subscribe. It would help out, and we can spread the word to other seniors to help them make an informed decision, not a decision based on what their neighbor says or Joe Namath or some other celebrity. So please click the subscribe button below. So for the first category, folks that are going to be new to Medicare for the very first time and they're drawing Social Security benefits, all right? So you don't have to do anything. Social Security is going to automatically enroll you in Part A and Part B. Most people that are 65 or older are eligible for Part A for free. You've paid through your FICA taxes your whole life, so you're not going to have any type of a premium. Others, if you're married to somebody that did work 10 years, you'll also get Part A for free. Otherwise, you could have a penalty. For Part B, they're just going to take out the $174.70. Could be higher for high income earners, and some people below $1,715 a month might be able to get their Part B paid for free. You would not have to pay your Part B premium, but you have to enroll in that. So just remember, your Medicare card is going to be mailed out to you shortly before your Part A and Part B effective dates. You don't have to do anything. And just remember, the Medicare initial enrollment period when you turn 65 is 3 months before your 65th birthday month, the month you turn 65, and 3 months after. Okay, so many of you may be turning 65 or enrolling in Part B for the first time, and you're not drawing any Social Security benefits. You've decided financially it makes more sense to move it to maybe 67 so you get more of your benefit. You've talked to your financial planner, whatever the case may be. So if you're delaying Social Security benefits past 65, Medicare doesn't automatically enroll you. You got to take the initiative by creating a myssa.gov account. That's going to get the ball rolling. I also recommend that you use Easy Pay to pay for your Part B. Otherwise, you're going to have to mail out a check every quarter for your Part B premium. Now, what you got to do is I have steps in this PowerPoint that are going to show you how to set up your myssa account. You're going to create an account. They're going to ask you verification questions like where did you live back in 1998, or you may want to have certain items on hand to be prepared for additional security questions like your W-2s, your tax forms, make sure you got your cell phone number. This link right here, I wouldn't click that yet. That takes you right to applying for Medicare. You can't do that. If you go to that link, it'll make you do a myssa account, all right? So this video right here on page 5 is the best video I've ever seen on how to create your myssa account. It's crystal clear. You just click the play button. It's about a 3 or 4 minute video, and he says it more eloquently than I could on how to set up your myssa account. All right. Now, if you click this checklist, it's going to tell you what you're going to need before applying for Medicare or retirement or whatever the case may be. But if you click on it, you'll get a checklist, an online checklist for Medicare. What you need. You're going to need your date and place of birth. You're going to need, if you have Medicaid, what's your Medicaid number? What your current health insurance is. So all that stuff is here. You can also click here to set up your Part B premiums. It'll take you right to this page where you can basically just log into your Medicare or myssa account. And then what you can do is you can set it up so the $174.70, that Part B premium they take out every single month, you can set that up so it comes right out of your bank account a lot easier, smoother than mailing out a check every 3 months, okay? Now, and again, right here, apply online. Even if you're not ready, you click here. You can go right. You can download the Medicare checklist on what you need to do online to apply for Part A and Part B online. All right. Other ways to apply for benefits: you go to your local Social Security office. You could call 1-800-772-1213. I would avoid that. That you might never get to speak to somebody. So I would just go online or go to your Social Security office. All right. Now, what happens if you're still working? So many people work past 65. So you're eligible for Medicare when you turn 65, regardless if you're taking out Social Security income benefits. However, even though you're eligible for Medicare when you turn 65, when you should enroll in Medicare depends on whether or not you're still working, whether or not you still have group insurance. So Medicare benefits can coordinate very well with your employer coverage, but how Medicare coordinates with your group insurance depends on how many employees are in your company. So when is Medicare primary and secondary? Let's do an example. So let's say you work for General Electric, big giant company, or maybe AT&T. Obviously, that is a company with 20 plus employees. If you are part of a large corporation with 20 or more employees, your employer coverage is going to be primary. Medicare is going to be your secondary coverage. So then we got to ask ourselves this question. Do you really want to have Medicare Part A and Part B? Part B costs $174.70. If Medicare is going to be your secondary insurance, you need to call an agent, somebody well-informed with group insurance and understands and compare and contrast the differences in the costs to kind of do a cost-benefit analysis, because if your group insurance is paying first, it's covering your Part B already. You don't need Medicare Part B. You don't need to shell out $174.70. And I've seen too many times when you call Medicare, they're like, nope, you need Part A and Part B. Not true. They just cost you $174.70 every single month when your group coverage will suffice. So my point is this. You want to call your HR department. You want to look at your summary benefits. You want to find out what kind of insurance you have. How much less would it be if you're the spouse and let's say your husband or your wife is working? If they took you off that, would your group insurance premium go down? A lot of moving parts there, but just remember, you don't need to get Medicare Part B. You might as well get Part A. Part A is free as long as you work more than 10 years. Get Part A, because a lot of times that's going to help you with the hospital. Your group insurance pays first, Medicare Part A pays second, and the two coordinate where you might not even have a hospital bill. But as far as Part B goes, do you really want to pay that $174.70, knowing that your group coverage is already taking care of your Part B, which is everything outside of the hospital, your outpatient stuff, your blood work, your doctors, things of that nature. So you don't really need a drug plan if you have group coverage, because that covers your drugs as well. So really just get the Part A out in most cases. Now, if you're a part of a company with 20 or less employees, Medicare is going to be primary, so you got to get Part A and Part B. All right, your employer coverage is going to be secondary. Got to have Part A and Part B. So if it's a fewer than 20 employees, you need to enroll in Part A and Part B ASAP. Okay, guys, so just remember, underneath this video, you can click on enrolling in Medicare 2024, and you will have this interactive book where there are links that work. For instance, you're losing your group coverage. Let's say you're losing it the last day of April. So you got to hurry up. And fortunately, when you turned 65 a couple years back, you realized Part A was free. You enrolled in Part A, but you held off on Part B because you didn't want to pay the $174 Part B monthly premium, because your group insurance was doing just fine for you. So what do you have to do knowing your coverage ends the last day of April? Two things. And you have Part A already. First thing you have to do is you have to apply for Part B. How do you do that? You can just click, like I said, click on this interactive PowerPoint on page 9. You just click, download application for Part B. There it is. You just fill out this area right here, your Medicare number from your Part A, your city, your mailing address, just a few simple things, guys. And then what are you going to do? You're going to click on download your request for employer information. What is that? Where you're going to click, you can download it, and you can send it to your HR department. They're going to fill out your last day of coverage, when your first day of coverage started, your information, your social number, all that good stuff. It's a one-page simple form. Once you get those two forms signed and filled out, then all you got to do is click right here and apply for Medicare Online, Medicare Part B Online. Those two forms that you had HR fill out and yourself, you filled out the Part B enrollment application, you're just going to upload those and you're done. Within 4 weeks, you're going to get your Medicare card in the mail that says Part A, and it's going to say Part B. What's the Part B going to say? Well, hopefully, if let's say you want your Part B to start May 1st or June 1st, it'll say 5/1/2024. All right? But in order to do that, you got to fill out the Part B application, the request for employee information. Once you do those two things, you're ready to go. And do it online. It's so much faster. You could go to the Social Security office and have them help you. That's one option, but I would just do it online. Now, if a couple years ago when you turned 65, you didn't get Part A or Part B, you got to create a myssa account. And like I said earlier, you just turn the page right here, page 5 of 16, guys. Get this enrollment guide. It's incredible. It's got links that work. You click here, tells you everything you need before you enroll in Medicare Online. I have a great video on enrolling in Medicare when losing group coverage. I got the forms that you need to download. I've got everything. I got the link where you click this and you take the forms and upload it to that site. So you're good to go, guys. Now, real quick, I want you to understand, when you are first going on Medicare, you got 3 months before your 65th birthday to enroll in Medicare. You got the month of, and you got 3 months after to enroll in Medicare Part A and Part B. If you don't do that, you could get a Part B penalty, all right? And just remember, when we go back here, when you lose your group coverage and you enroll in Part B, it's an 8-month special election period. What do I mean? So the Part B starts when you have the Part B special enrollment period starts when you have coverage from your current job-based insurance and you're in the first month of eligibility for Part B, meaning you filled out the request for employment information, you did your Part B application, you submitted it to Medicare, and so you've got 8 months from the time you enrolled in Part B when you were eligible for it. You got 8 months after you lose coverage from your current employment because the employment or insurance ends. Using the Part B SEP also means you will not have to pay a Part B enrollment penalty. Thank God for that. Now remember, job-based insurance is not the same as COBRA, and it's not the same as retiree coverage. Two totally different animals, all right? So you got to be aware of that. And if you miss, let's say you were eligible to enroll in Part B, today, and you pushed it off, and you didn't do it in the 7-month period, the 3 months before you turn 65, the month of, and 3 months after, you could very well get a Part B penalty. And then and the only time you can enroll in Part B is during your general enrollment period, and that's between January 1st and March 31st. It's right here, and this form will be available to you on my PowerPoint, interactive PowerPoint presentation. All right. If you don't meet the criteria listed above, you are not eligible for the SEP. Let's say you didn't lose your group insurance. You just forgot to enroll in Part B. You may have to use your general election period to enroll in Medicare. That takes place January 1st to March 31st of each year. When you enroll during the general election period, coverage begins the first month after you enroll. So if you enroll in March, your Part B starts April 1st. All right, and the last thing I want to say about enrollment, and this is crucial, is I think the most important Medicare enrollment period, it's the least talked about, is your Medigap open enrollment period. What is that? All right. Let's say your Part A and Part B effective dates are April 1st to 2024. When you have, this is a once in a lifetime enrollment period. It's called your open enrollment Medigap period. You have a 6-month window once per lifetime when you can enroll in a Medicare supplement with no health questions asked, no denials. You can get any Medicare supplement you want. You get the Plan G, the Plan N, the high deductible G, whatever you feel like. You get to pick your supplement letter, and you can go with the lowest premium of all the companies in your area with an A-rated company. So when does it start? Open enrollment for Medigap starts when you get your Part B or you're turning 65. When you enroll in Part B or you're turning 65, your open enrollment starts. And it's 6 months. It's the month that you turn 65 or enroll in Part B, then the second month, third month, fourth month, fifth month, and it ends the 6th month that you have Part B, or your Part B effective date, or when you turn 65. You got that 6-month window where you don't have to answer any health questions. You don't have to answer any underwriting questions whatsoever. You can get the best A-rated carrier with the lowest premium of your choosing. You don't have to get sucked into going into the Plan G. You can get a Plan N. You're at the driver's seat. You decide which supplement you want, and they are not allowed to ask you any health questions, no underwriting. So guys, again, subscribe below. Hit the subscribe button. We'd love to hear from you. And then if you do hit the subscribe button, you're going to get alerted to when our next video is. And tomorrow, we are going to talk about Medicare Advantage or Medicare Supplement. All right?